we can pass this around to you after the presentation itself. But if you have any questions, please do feel free to use the IM window, and we'll take those as we go through. Other than that, Tim, over to you.
Thanks, Mike, and good afternoon, everyone. I hope everyone's having a good day. Thanks for tuning in. My name's Tim G. I'm the Public Sector Sales Manager at Visual. Visual is very proud to have received the Microsoft Partner of the Year this year from Microsoft. We've been in operation for 10 years, and we've had in place. Long-term commission management in a lot more prevalent in this day and age. Social diseases, where interaction needs to be more fluid and flexible for the individuals that are being serviced. As each of these things change, sometimes the change comes from the people that you're serving or the workforce that you've had and their own consumption of IT outside of the healthcare environment or their work environment. And that drives change as well. So the key thing here is, from our perspective anyway, and I would challenge any partner, SI, Microsoft partner or otherwise, that actually transformation needs to be top of the agenda, translating technology into transformation. But also when you're looking at a strategy, it needs to be a strategy of change and coping with change, not just for the short, medium, but also long term as well. When I engage across public sector and particularly in healthcare, the more we get opportunity to engage at the right level, the more we find that there are standard things that come up in conversation. Now, I know in a healthcare scenario, you are all subtly different in your own ways. I absolutely appreciate that. And, the people that you're serving, the demographics of the people that you're serving may be subtly different. If you're in the Bournemouth region, you might be dealing with a higher propensity of elderly people, and in other regions you might be dealing with a higher rate of younger people and younger issues. Certainly if you're dealing with people in places like Cumbria, then they have a specific set of problems in dealing with holiday and vacational healthcare scenarios as well, where an influx of people coming in for the holidays in certain times can put pressure on the health economy in those regions. But the point I'm making here is, again, for us, it's about understanding common themes in public sector in healthcare. And I know that, at a high level, that's all about reducing costs or balancing the books. But at the same time, balancing that with improving outcomes as well. Cost efficiencies, cost savings, cashable savings, always coming up in conversations. And that needs to be balanced with some of the outcomes that you can deliver. And, I've just got 3 or 4 here that constantly come up in my conversations. Consumer-driven empowerment, I think I've just mentioned some of that in terms of empowering the people that you are serving, helping them to take control of some of their health and wellness, channel shifting the way in which you deliver information to them, the way that you collaborate with them, and wrapping the service around the citizen rather than the service being adjacent to the citizen. And as I said, I guess a constant battle of trying to do enough to be proactive in the service, or using IT to be at the cornerstone of being proactive with your citizens or patients that you serve, rather than letting the issues become something that's reactive and then having to deal with them in a non-controlled way. Partnering for successful care is absolutely top of mind for health and social care interaction. I'm sure many of you on this call will be interacting, I would guess, with emergency services, be it fire, police, and ambulatory services. I would suggest that you would be, depending on whether you're a commissioner or a provider, acute, foundation or community focused, that you'll be dealing with local regional government and social care entities. And there's a real need, I see that all the time, where entities or resources from social care and local regional government and community health individuals are sharing the same office and trying to share the same information to safeguard and serve individuals that they're serving. I would guess there's also elements there of interaction with charitable organisations as well, be it around care, extended care, like things like Macmillan, for instance, or some of the mental health charities that might be supporting some of the patients that you have. And equally, there are lots of obviously private partnerships that you have specific to care, whether it's some private entities, private resources, private consultation, or private health entities or insurance brokers. And again, having IT at the centre of that to underpin some of those interactions is critical, and we see that a lot. Information access and transparency. I'm going to show you some things later on in here around the use of information, and I've been a great supporter of information being at the heart of everything that you do in healthcare. Not that you can just see the information and make decisions on that that are essentially rear view mirror decisions, i.e. you're looking at some data that's happened in the past, but really using BI and particularly when you think about machine analytics or machine learning to dictate where you need to focus your commissioning services, or dictate where you need to put resources to better serve the people that you're dealing with in the region. So important really in terms of foundation hospitals or foundation trusts that are obviously responsible to the people that they deal with in the region as well. And obviously quality maintained and monitored, that goes without saying. So for us, it's about understanding these key themes and driving conversation with the customer that really highlights the priorities that you're trying to do, be it as a commissioner, be it as a provider, community or acute, and really trying to ensure that first and foremost, IT is seen as a strategic asset for your organisation, as an enabler and not a cost centre. Regional have taken this a hell of a lot further than that in many respects, and as I said, I've been dealing with healthcare organisations for a long time, and what we're trying to do is to take this to another level. So this vision for supporting healthcare is we've put together for our consultants, our salespeople, to really challenge you again on what's really important to you, and just to show our commitment to the healthcare market. And you see from here, what we're trying to do is just give you almost, and excuse the terminology, but almost a Chinese takeaway menu of solutions that could be apparent or could be important for you. We've been very, very clear here to keep the technology out of these descriptions, to make the technology a consequence of a very strong strategy for innovation and change and transformation. And what we're doing here is saying, okay, let's look at what solutions that we have delivered across our commercial or public sector customers or into health specifically, and start to commoditize those, where we're in front of either a commissioner, commissioning body, or a provider, community or secondary care, that we can talk about how technology can drive change. And I'm happy to share this we'll share the slides, and it's obviously been recorded anyway. But just to really say that, for us, it's about getting into the detail of what you're trying to achieve, and what your priorities are, and challenging that all the time. So when we challenge our customers, we're always leading with transformation, and we're acutely aware that this is technology as a whole is challenging, and in a marketplace where service needs to change dramatically and constantly, then actually you might not have all the answers to putting a strategy together. And we are 100% Microsoft focused. We deal with all of the Microsoft products, and I guess organically, as we've been dealing with people around things like Skype for Business, previously Link, System Center, Hyper-V, SharePoint, Office 365, and the customers themselves have been drawing us more to say, well, that's great that you're doing that piece of work on that bit of technology, but how does that link into the priorities that we've got as an organization? So they've been drawing us to something more than just a workload or product-based interaction. And about 2.5, 3 years ago, we made a decision through those conversations to start to focus on a strategy, a transformation of strategy. These are commoditized deliverables around 3 specific areas. One, it's around enhancing infrastructure operations and process. For the people on the call, that would be a healthcare infrastructure operations and process. 2, about empowering the workforce, the healthcare workforce, with all the tools that they need to do what they need to do on a daily basis. And equally then, a strategy for understanding how you have the right business intelligence or workflow or CRM tools to engage with the citizens or patients that you're dealing with. So ideally, when we're engaged with a customer, a healthcare customer, we'll be reverse engineering from trying to understand, if you're asking us from IT work or IT help, first and foremost, how is this underpinning an engagement strategy that is going to make a difference to the citizens or patients that you're dealing with? What is this technology going to do that's going to make a difference to the way in which you engage in that? And that for us is what we call connected business. If we know what that strategy is, then equally, how do you empower your healthcare workforce to deal with that strategy? And we know that could be different in many ways, whether it's a consultant in a secondary care acute hospital that needs to know information and access to information for what they're consulting on or operating theatre, etc., or whether it's a community worker and giving access around mobility to information so that they can service the individuals in the community in a better way, or whether it's the way in which you communicate and collaborate with your partners, or indeed service through technologies, telehealth, telecare, telementoring, using the technology to empower that engagement with the people that you're servicing. And of course, reverse engineering from that, which is typically where the IT conversations come from, is then how do you have an infrastructure that is fluid, flexible, and gives enough agility to deal with those two strategies. And I hope this makes sense to everyone. It certainly makes sense to us. And whilst it does seem very, very simple in its approach, it's very, very strong in terms of its approach and the ability for us to help individuals through these three transformational propositions to really bring out a health-empowered cloud platform that can hold its own in terms of technology, empowering the workforce and engaging with the people that you're serving. The result of that for us is, of course, that we are able then to very much focus on all of the technologies as a cloud-enabled platform to underpin that strategy. And we are, as I said, we're 100% Microsoft focused. We don't deal with any other competitive technologies. And that has done us very, very well over the course of the last 10 years. And we're very proud to be involved in a lot of the engagements at an engagement manager level or a campaign or initiative based level with Microsoft driving this agenda. I don't think there's anybody else in the market can touch Microsoft in terms of this end-to-end cloud platform. And you can see some of the technologies there. And I just want to make it clear that we don't force the cloud onto anyone. We are very, very acutely aware of the fact that across healthcare there's a lot of systems, best of breed systems that need to be housed on premise. There is investments that's been made on premise. But what I would say is we are absolutely challenging everyone in the healthcare and NHS to have cloud as part of their plan. Bearing in mind what we said before, it's a transformational agenda, it's a continuum of change. It would be absolutely ridiculous not to have some kind of cloud within that plan. We're seeing uptake, more specific uptake, and more aggressive uptake in places like central government that have had a dictate from the centre around cloud first, and obviously G Cloud underpinning that. We've seen significant uptake as well in local regional government, and we're just seeing a momentum of uptake in healthcare across these technologies. But to be clear, we look across all of the investments that you've got, how you do things, how you need to govern information, and we challenge the cloud, the Microsoft cloud, to fit into those things, but equally be respectful of the investment that you've made already. It wasn't my intention to go into any of those technologies with any great depth. I'm happy to do that. We've got a whole bunch of people in our team, 50-odd consultants that will talk the hind legs off anyone that wants to know about these technologies. I'm not a techie. I have a perspective on all these things, but the key message here is if you're working out a strategy and you want a vendor that can cover all of these things, then we firmly believe that Microsoft is the only one in the marketplace to deal with all of these things together and in isolation. The key thing for me here that I do want to talk about is when you get this right and you work around these strategic principles and this continuum of change, and you start to embed some of these technologies either on-premise, hybrid, in the cloud, then the result of that is transformational customer stories. And you'll see here that, I mean, we deal with all of the public sector verticals across local, regional government, central government, police, fire and rescue, emergency services, education and health. At the moment, healthcare, in terms of number of organisations and revenue, is about 15% of our business here, which in turn, the public sector is about 65 to 70% of our business here as usual. It's a big part of what we do. But I did want to, again, this is about sharing with you stories and to share with you the art of the possible in many respects. And when you look across some of these wins that we've got here, there are lots of similarities in what we've done in some of these organisations that could be applied to health. So first and foremost, let's just take a couple from the top on here. Derby College, well, we've been working with Derby College around the use of CRM, customer relationship management, the Dynamics platform, to help the college and its students to have a workflow of learning, a learning workflow. And you can see how that could be applied to many healthcare organisations have affiliation with universities and nursing or medical courses. So you can see how that can be applied to that. But also, you know, learning is about access to information and giving individuals or the workforce ability to learn or upskill themselves, digital skills, etc. So where Derby College are using this to transition their students through the learning environment. So, for instance, a hairdresser might be on a specific learning pathway, but if that hairdresser is dealing with peroxides, then that he may not know that they're probably just as skilled as that stage as somebody that's dealing with biochemicals, for instance. So it's about showing different tracks and highlighting those tracks by the technology, and then equally through that learning portal to connect those individuals with opportunities outside of the college that might be apparent in employment and careers. So the point I'm saying there is we're doing these things across public sector, and it's only a hop, skip and a jump away from putting that into a healthcare context, whether it's around clinical learning, whether it's about delivering health and safety messages, whether it's about delivering training or governance, whether it's about helping people through their care pathway, for instance, with the same kind of technologies. So I hope you're getting a view of that as I'm talking through this. Scottish Fire and Rescue is an interesting one. We have built out and developed a platform for operational intelligence for them. We've built on the Azure platform a mobile-aware business intelligence system that allows the firefighters at a point of incident to consolidate critical information. So that includes water mains, gas mains, building makeup, number of people in the building, or anything else that might be apparent at the source of an incident. They did that for some very emotional reasons to safeguard the firefighters as they were turning up on site and making sure that they weren't any in danger of falling through any mezzanine floors or not being fully aware of any kind of gas mains or explosions at the point of incident. So that's mobile aware. It's on a tablet. It's mobilized on mobile Windows mobile phones. But again, it's using the Azure platform and taking business intelligence, whether it's their own business intelligence or getting hold of anonymized data that might be appropriate to the region. But again, a hop, skip, and a jump away around ambulatory services and giving information ambulatory services to them at the point of incident, or even safeguarding community workers. If you think about community workers going out into social to deal with social care issues in the community and making sure that they know who they're going to see, whether they've got any more information that might come from internal systems, healthcare internal systems, or local regional government systems, to ensure that they know the household that they're going into and any particular issues that may be apparent in there. There's a couple of others here that I'll talk about. Care International is a worldwide charity that we've been working with. As you can imagine, from a charitable organisation that's dealing with humanitarian crises across the world, they are faced with a number of challenges about getting information and collaborative technology and platform to the point of incident, be that in Africa, Asia, or anywhere in Europe. We've been working with them to utilize Office 365 as part of the platform to deliver some of those communication collaboration technologies wherever they may be. And again, a hop, skip and a jump away around. You think about disconnected domains with some of the partners that you've got, the fact that you might need to have some kind of emergency or pandemic type services or plans in place to mobilize resources very quickly. Again, the technology is there and the stories are there, and we're dealing with these things, not necessarily all in health, but they're only a hop, skip and a jump away from what we can do to help you guys. Bradford District Care is one that we're particularly pleased with. We've been working with the community trust as they move away from a shared services environment to give them a more agile and flexible desktop for mobile working, use some of the technologies up there, and they're again preparing for the cloud and moving forward with the cloud. All of these things, by the way, can be unlocked very, very quickly with a small investment. We do a cloud readiness investment that gets some of our best guys in front of our customers to really show how these things can come together. So, just wanted to change tack a little bit because I want to show you some things, and I'm just very, very conscious of time. We've probably got about 20 minutes now. And I'm sharing my screen here, but I've put the art of the possible, but some of these are art of the possible, but some of these are absolutely in place at the moment. So I'm just going to jump out of my on my presentation. First and foremost, I'm going to put up my Internet Explorer here and just show you a website for Health Vault. Now, not many of you may know this, but Microsoft not only do some great applications to change the way in which you transform your classic infrastructure, but also they've been working hard for a number of years around technologies that are consumer driven. I'm not sure if everybody's come across Health Vault before, but I would absolutely ask each of you to have a look at it. It's basically I've got no other way of explaining, but it's an online health bank account. And any of you out there as consumers, citizens can log on to this and apply yourself to an account. Now, I'm a user of the Microsoft Band. I don't know if anybody else is. I find this fairly fascinating. I used Fitbit before I got my band. And I'm again one of these individuals that I don't know where all the data's going, but it's certainly helping me. It tells me how much I've slept at night. I've got 2 young children, so that's quite interesting. It tells me how many steps I'm doing. It helps me to log where I'm going on my bike or workouts. And I guess there's different ways of accessing that information. I can do that through the normal healthcare account, but interestingly, Health Vault as a platform allows you to utilize technologies, connection technologies, to start to surface some of the things that you may be tracking. So this is my Health Vault account, and I make no apologies for what's on here. I kind of use it as not so much as a personal thing, but as a demonstration thing. But I've got things connected, and you can see as I come in here with my own personal live ID. It's given me access to a whole bunch of information. You can see most recently it's updated some of the steps that it's taken from my band. I've got that connected to the Microsoft Health application, and therefore it's pulling things through from my band as it becomes apparent. You'll see that the date on the weight is slightly outdated. That's because my Wi-Fi scales in my bathroom. Yes, that's right. I've got some Wi-Fi scales in my bathroom. They're connected to my Wi-Fi internet through the Fitbit account. And that allows me to track my weight on a regular basis. It's just that I haven't renewed my Fitbit account for a while. So that's why it's saying March. But it's not hard to just get back into the Fitbit account and sync all of this stuff. It allows me it automatically gives me body composition from the weighing scales as well. Exercise, food and drink I can input. It allows me to put additional things in here. If you're thinking I've got some long-term conditions like diabetes, I can input those manually, or I can take some of the USB devices that are out there and start to do those automatically as well. I can put in my current health issues. I'm touch wood, I don't feel as though I've got any current health issues at the moment, but I have some sciatica issues some years back. I don't have any medications other than multivitamins. I can put in some things here about up and coming appointments. I've got my contacts, my mother and my wife in there. And interestingly, it's given me a view of some of the updates that it's had recently. So I can just go on to here and it'll tell me my sleep last night. It tells me that I had a fairly broken sleep last night in terms of the band and what the band was showing me. So it's pulling information from, this is my personal information, it's my personal health vault, and I'm asking it to connect with applications that I want to share information with. Now, the other interesting thing here, of course, is a whole bunch of applications you can connect with it on. But equally, what I can do through this platform is I can start to share that health information with anybody that I see fit. That could be my wife, it could be a carer, it could be my GP. You do that through a two-way authentication. But you know, my mother suffers with diabetes, and I'm trying to get her set up with a Health Vault account at the moment. That she's in her 70s, so some resistance there. But she walks half an hour every couple of weeks down to the GP to get weighed. I'm like, well, hold on a sec. You know, we can automate all this stuff. We can share it with the GP. And equally, by getting her into something that's automated, we can see any challenges in either weight increase or drop of weight that could be underpinning something more serious. So anyway, I just wanted to give you an insight into this because I said it was going to be a bit of the art of the possible. But you know, this platform exists. You can develop on this platform, and certainly from a visual perspective, we're intrigued by this platform and what the platform can give. So let me just change pace a little bit here because you can see that use of BI in terms of what Health Vault can do. So, so interestingly, let me just show you this. This is Power BI. I don't know if anybody's used this before, and this is part of Office 365. It's a cloud-based service, and we built this out. I'm going to move at pace, by the way, guys. I'm going to show you a lot of stuff here. And this is essentially we've taken some anonymized data from on dementia and diagnosis rates and the use of antipsychotic drugs, and this is all being delivered to me by the web. I can go to any of these areas, and this is obviously using Bing Maps, and it's mapping some of the data onto the UK, and it can start to show me some of the instances or how that data is aligned on Bing Map. You'll also see that as I was putting that together, there were some places in North America. That's because it's taken the data on things like York, and there is a place name in York called America. So it's just, it also shows here that looking at data in different ways could show anomalies that you might need to fix. But, you know, just a rich way of showing data in different ways, drilling down on data specifically if you wanted to, and offering data or intelligence to a whole bunch more people than just a group of elite that might just need information, for instance. So just a quick view of that. I'm a member of the Foundation Trust, East Midlands Foundation Trust Ambulance, and also Burton Hospitals. I tend to get a lot of information by email or PDF. I just wanted to show you something here in terms of, again, a cloud-aware product called Sway. This is a weekly newsletter, a weekly broadcast that we get out across Visual. And you'll see here some pictures that we were given IT services company, best IT services company of the year to work for last week, and this gets broadcast to everyone. It's a web-based service. It's no need for PDF, no need for email, no need for email or storage overhead from sending PDF for people. And equally, what it does, it gives us the ability to have much richer interaction with information that might be in here. So just think about the things that you're trying to broadcast as a foundation trust, for instance, out to the members, or equally out to the people within your organisation. Equally, we deliver our own brochures through this route, and you'll see by here I've got a quite interesting URL, and this has been built by our team to show that we call it shortened 365. So if you've got any very complicated SharePoint, intranet SharePoint sites with long URLs, then actually we've built on a platform, again at the cloud platform, a shortener that allows us to say risu.al public sector brochure. And that's open to anyone on this call to go to, by the way. And if you go to that area, you'll be able to see our online brochure. And again, this just adds a different dimension to the way in which you could be delivering information out to your health workers, the patients, citizens that you serve, the partners or the foundation members or members or governors of the trust that you're in. So I want to show, I want to come back to my presentation, and Mike, you just need to keep, how much time have I got now?
15 minutes.
Okay, great. So I want to talk about and show you the use of some technologies that we've built out. We've built them as solution accelerators on top of the cloud platform. That's CRM, Office 365, sometimes Azure. And I want to show you these things because these are solution accelerators that will hopefully give you some indication of how you use that platform, or how you may want to develop some things yourselves. Very simple things that can be very, very impactful. I'm going to show you a few things. This comes from a product suite that we call Minerva, and hopefully this will work. I did say I have got some screenshots here just in case we have some problems, but I'm just going to go to my project my screen app here, and hopefully everyone can see that. I'm just going to show you, these are all available as rich web apps anyway, but I just want to again show you that once you get something in place now on the Microsoft Develop platform, it's very, very easy to transition that across web, classic desktop and mobile. And this is what we've done here, right? We've made these applications mobile aware. And actually, some of these are actually in the Microsoft App Portal as well to download. And we sell this as part of a consolidated software suite that fits onto Office 365 as its solution accelerators. Now, I'm going to show you a few things, and I'll move at pace. Hopefully that all these things will work. So the first thing I want to show you is a little application called Room 365. And Room 365 really is the ability, quite simply, to book rooms, utilizing some of the native capabilities in Office 365 and Exchange, but also building on top of that with things like SharePoint Online as well. And we've done this in conjunction with one of our customers, City and Guilds, because they've got a lot of rooms that they need to book. And the challenge was not just booking the rooms against the meetings that they had, but booking facilities and resources for those rooms. Now, so again, if you think about that, and I know there are theatre booking applications out there, but clinical rooms, drop-in rooms, GP appointment rooms, nursing rooms, where you might need to have certain resources aligned to those rooms before you book them, or get a view of the layout based on who you're going to see and what you're going to do in those rooms. This could work really well. So, online reservations are on there. We can see catering is, obviously we're talking about catering here, but that could be resources as well. Equipment that might be in the room, you see that we've got some of the equipment in terms of laptops and projectors and such like, but again, that could be any kind of medical or ported equipment that could be ported to the room and dictated by that. And of course, when you're going in there, in terms of the information, and this would obviously be available to people that are booking the rooms, nurses, consultants, etc., community workers, and they would need to see, they could see a picture of the equipment that would be apparent for that room or bookable for that room. Obviously, in terms of the rooms, again, we've got some of our rooms in here, but you can get a view of what the room is, the capacity of the room, and the layout of the room. And equally, as I say, we've got catering here, but that could be other resources, be it people resources that you might need in that room at the same time, specifically for triage purposes or observation purposes. So again, I'm going to move through these at pace, but I just want to give you an indication of the capability of the platform and the ability to develop things that could be specific for you guys in healthcare on top of that. So the second one I wanted to show you was something called Places 365. Now, if anyone of you're out there have done something or utilized as a consumer TripAdvisor, then think of this as really a TripAdvisor for you in a corporate entity. Now, again, if you think about, we've got some categories of places here. Now, this could be actually something that you deliver out to the region, and these categories of places could be GP surgeries, it could be pharmacies, it could be community drop-in centres, it could be anything that you want to dictate to those citizens by using this app or to the patients, so that you can start to gather information around their feedback on the resources, the interaction, or the ability to find those places. So again, very, very quickly, the application will give you a view. We're talking about the Premier Inn here in Stafford. Obviously, some of our consultants use that. They're giving it a rating. They're putting some commentary back in there. And equally, then, we can start to look at where these places are. And equally, it can show you how to get to these places as well. Now, I know NHS Choices, as was, has a bit of this in here, but I guess the point is here is that's generically finding some official places that you might have in your economy, your health economy in the region. This is about accelerating some of the things that you might want to do as an economy, either foundation, trust, GP or commissioner, around the subtleties, because the subtleties of a day drop-in centre could be that it's not a fixed abode, it might be moving around, and therefore having it in here and again capturing the interaction of the individuals and finding where they can go for those drop-in centres. I know certainly Queen's Hospital sent me a newsletter, a PDF newsletter about drop-in centres for knee and leg pain a couple of weeks back, and obviously you can have those drop-in centres part of this this application. Apologies, it's bombing out on me a little bit. And then with that in line, the third one I want to show you here was essentially Events 365. And again, I've just given you a clear example of where, if you're wanting to advertise to the local economy some events that are going on, I certainly get a lot of information that's coming up around East Midlands Ambulance and forums that are happening, or governor forums that are happening. So again, you can start to project these out to either to your workforce, whether it's workforce enabled training, whether it's social groups within the workforce, or additionally out to the patient or citizen layer. And of course, again, we've got some events here. You can see the classic visual type engagement events. We can put the summary down here. We can put the agenda. And we can start to apply some things in here that would absolutely. Okay, I'm getting direction from my team here to go into a couple of these to show it in a little bit more detail. So again, you can see here the session breaks down, and you can start to see what the agenda of the session is. But again, what I'm trying to do here is just move at pace to give you some indication of how powerful this platform is, not just from a productivity perspective out of the box. Obviously, we're using Skype for Business here to project this out to you. That could equally be put in around telementoring, outreach to patients, outreach to individual patients, whether it's social groups or support groups. But equally, with a little bit of development, these can be turned into something that's really rich. The other thing is Cases 365. So interestingly, if you think about the number of cases that are apparent in healthcare, I know there's a lot of case management systems, best of breed case management systems that might be apparent for different things within healthcare, but Equally, I think there's a need for something to layer across those case management systems, particularly if you're thinking about safeguarding your people or safeguarding patients that are in social care environments. So you might not necessarily have the correct access as a healthcare worker to the social care system, but you would absolutely want to make sure that you're capturing anything in a case or interaction that might be in the social care environment that would represent a threat to either the people that you're dealing with or the people that are serving it. Equally, it just could be a case in terms of pulling back some information around a specific area, a specific person. Well, it could be anything. I'm sure you guys have got your head around what that would mean. So this is pulling on Office 365 and CRM. We built this out essentially, if it works, and started to build this out in a local regional government scenario to report cases that may be specific to littering, for instance. We could obviously determine a drop-down box for you to dictate what the cases can be and to help accelerate those cases. Free text box that can contain some information. Now, I know we're having a little bit of problems with this in terms of this coming through in our location at the moment, but you can pick a location, essentially. We're using Bing Maps here. Just takes a little bit of time, or it was taking a little bit of time to bring us back to our location, which is Stafford. The phone is location aware, so depending on where the individual is, the worker is, it will automatically pick it up. But let's just, for instance, we could pick where we are at the moment. It might just take a few minutes just to bring that through. But let me just take you to the next. Let's see if it works here. Because it's not picking up the location, it's not letting me go to the next stage. No. I think we'll come back to that one in a second. Let's just give it another go. But anyway, you get the point here. Essentially, we can pinpoint the location. At the moment, the reason it's holding this up is because it's trying to find out where we are as a location rather than allowing me to just do it on this where it thinks we are from previous. And then when we click on next here, then essentially it gives me the ability to add further detail, like a photo, for instance, or any other detail before the case is logged. Essentially, we can also do contact with individual around a query and just have a really rich app here in terms of what the query is and have that triage through CRM into the relevant people and have that dealt with in the right way. Alternatively, again, just quick contact for anything that may be apparent or needs immediate assistance. So apologies that caused a little bit of problem there. I did say that the demo gods might be with me or not, but I hope you get the gist of what we're saying here. Office 365, CRM, Azure as a platform is really rich with just some native functionality, but with just a little bit of innovative thought and an application on top of that, you can really build some rich apps that just are simple, but can make a hell of a difference across, I think, all the public sector areas, as well as health. So let's just come back to some of the things that I wanted to show you. I just wanted to highlight here a couple of things from ourselves. Skype for Business is a fantastic tool. We are doing a lot of work in Skype for Business in healthcare and public sector scenarios. We partner with technology and software partners to get more of a richer application on top of those technologies. And Anyway 365 is a great example of that. I've got a video demo that I'm happy to send out to everyone just to give them an indication of this. I don't think we've got time to show it at the moment, but this Anywhere 365 sits very, very tightly on top of your investment for Skype or Link, and it turns Skype or Link into a voice routing mechanism or an instant message routing mechanism. So essentially turning it into a call center environment where you can call into Skype, it can triage the call, press 1 for GP appointments, press 2 for additional information, and equally then drive and connect those individuals with a hunt group of people potentially, whether it's consultation or GP or admin or secretariat, and get those things dealt with in a more efficient manner. You also see on here that actually on this website it has a live chat, so you can embed this into your website or publicly facing internet sites, intranet sites, and again using the instant message technology that's embedded into Skype for Business. Then you can also start to triage some of the questions that you might have of patients to deliver them to the right people in the right place at the right time. So again, I'd really ask you to start looking not just on the Microsoft technologies, but how you get the best out of the investment by some technologies surrounding that. Run the generating innovative thought, both worldwide in the UK. This is the LinkedIn page, Microsoft Health. There's lots and lots of information in here, lots of things that I think it's worthwhile getting your head up and look what's going on around the globe, particularly in Americas and sometimes in Southeast Asia as well, around how technology is being used and some innovative thought about how Microsoft technology can help you today. So just for me to close down then, guys, if that's okay, is I just wanted to just take 1 minute just to talk about Visual and what we do. And I don't want any more than 1 minute on this. As you can see here, and I've talked about this throughout the live meeting, we're 100% Microsoft focused, we're 100% services focused. We deal with technical, business and managed services support, as well as IP and development. We've got a very, very close working relationship with the Microsoft account teams in health, some of which that I personally used to work with, manage and integrate with. We're very, very focused on doing the right thing for our customers and getting the best out of the investments that you've made in Microsoft, and that's resulted in a whole bunch of things that we're really proud of. Really, UK Partner of the Year, one of the best companies, best small companies to work for, and obviously recently last week one of the best IT services company, not one of the best IT services company to work for. Our customers mean a lot to us. We've got about 290 public sector customers, and we do our best to make sure that we understand what you're trying to do and how we can help get the best out of the investments that you've made. I think with that, I've got a couple of things here in terms of, if you want to get in touch with our team, publicsectorsales@visual.com. If you want to look at the brochure and the sway document that we showed earlier, that's risu.al/PC PS brochure. Now, I'm happy to open for questions. Please be aware that I'm not a techie, but I have been around Microsoft stuff for quite a long time, so I'm happy to take any questions from the floor or by IM. Or if not, I wish you all a very good day and weekend, and hope we get the opportunity to interact with you over the course of the coming weeks. Mike, was there anything you wanted to?
Thank you very much for that, Tim. I appreciate your time on the call today. Yeah, just to say thank you very much to Tim and Visual for supporting on this, but also we do have the last in our webinar series going on next Friday at the same time. We'll be looking at Office 365 E5 and the ability to put your telephony up in the cloud, as well as some interesting developments around some Microsoft UK data centers there as well. Feel free, of course, as Tim said, to put any questions you have into the Iron window. I've also unmuted the audience if anyone has anything. Otherwise, thank you very much for your attendance, and we look forward to working with you in the future. No, if there's no further questions, thank you very much for your time, everyone, and enjoy the rest of your day and your weekend. Thank you.
Thanks, everyone. Thanks, Mike. Thanks for the opportunity. I'll speak to you in a bit.
Bye bye.
Cheers then.